or someone who's been holding this institute down for years, today's a big one. We are celebrating our 27th Institution Day, 27 years of building India's public health backbone by n number of outbreak investigations, n number of research, n number of data sets, n number of sleepless deadlines. We all should be proud of this. Now please switch your phone to silent. Not off, we still want you to posting this later. And let's get into it. I'll be your host for the next couple of hours. Before starting, I'd like to invite our chief guest, Dr. Yvan J.F. Hutin, WHO representative to India, to come up to the stage. Followed by Dr. Manoj Murhekar, Director, Mr. A. Ilangovan, Scientist G, Dr. Girish Kumar, CP, Scientist F, Dr. Tarun Bhatnagar, Scientist F, Dr. P. Manikam, Scientist F, Dr. P. Ganesh Kumar, Scientist E. Please join us on stage. Before starting this, I would like to introduce myself. This is Preeta. I'm working here for the past 2 years as technical assistant in social science. Shall we start this with the tradition? Before anything else, I would like to start this with tradition asks us to pass and pay tribute to the soil we stand on and the tongue we speak. Let's begin with the Tamil Thai Vazhthu, our invocation to Mother Tamil. May I request everyone please rise for the invocation. Thank you everyone. You may be seated. Now, for one of my favorite parts of any Indian function, the lighting of the traditional lamp. It's not just a formality, it's basically the opening credit of the event, symbolizing the dispelling of darkness and the beginning of knowledge and wisdom. May I invite our chief guest, our director, and the dignitaries on the dais to please come forward and light the lamp. My colleague, Ms. Navya, will help with that. I would like to call our Senior Administrative Officer, Ms. Kaushya William, to the stage. Alright, moving on. You have probably heard us call ourselves the nice family, NICE, nice family, around here. And honestly, no family runs without someone steering the ship. I would like to welcome the person who does exactly that. It's my absolute pleasure to invite Dr. Manoj Murhekar, Director, ICMR-NIE, to deliver the Institution Day address. Sir, the floor is yours.
Thank you very much. Dr. Yvan Hutin, WHO representative to India and the chief guest of today's function. Students and staff members of ICMR National Institute of Epidemiology, colleagues from ICMR National Institute of Malaria Research, Dr. Surendran, Dr. Ramakrishnan, and friends. A very good morning and a warm welcome to all of you for the 27th Institution Day celebrations of ICMR National Institute of Epidemiology. Well, Institutional Day is always a special occasion, and this year's Institutional Day is even more special because our chief guest was part of NIE's journey for many years. During the early years of NIE and early years of Masters of Applied Epidemiology program, Dr. Yvan played very vital and very crucial role in establishing this program and later on strengthening it. We have continued to build on the platform that he helped in building. And today, FATP is one of the flagship programs of ICMR-NIE. We remain deeply grateful and always be indebted to you, Dr. Yvan, for your valuable contribution. And also I thank you for accepting our invitation to be here as the chief guest. The new cohort of MSc Biostatistics have joined about a week back. And the new cohort of MPH would be starting, I think, in the next week. And I take this opportunity to welcome these new students to NIE family. Well, Foundation Day also is an occasion to reflect on what we have achieved in the last year. Appreciate or thank the people, those who helped us achieving those or making those achievements, and also reflect on our strategic directions as to what we want to do as an institution in the coming days and coming years. So let me first talk about some of the achievements of this institution. And for any research institution, especially an institute within ICMR, the most important indicator of scientific output is number of papers or publications that the institute has published. During 25-26, that is the financial year, last financial year, NIE published 110 papers in peer-reviewed journals. And this has been second year consecutively that we have been crossing or we have been publishing more than 100 papers a year. And I want to take this opportunity to congratulate all the scientists, all the project staff, technical staff, and also the admin team for this wonderful scientific output, research output. At ICMR, we are using a different scale to measure the research outputs of different institutes. And this scale is called as ICMR Impact of Research and Innovation Scale, IRIS, ICMR IRIS. And this scale basically has 5 important parameters. The first parameter is about publications, the number of papers the institute has published, number of papers which were more than, which had impact factor of more than 10, number of papers which had citations of more than 100. So that is first parameter about publication. The second parameter is about public health impact, whether what impact your research has done on state, national, and international public health programs. The third parameter is clinical care impact. The fourth parameter is the patents that were awarded to the institute. And the last is new health technologies developed, validated, and commercialized. And every parameter basically is given what is called as publication equivalent. And based on the total publication equivalent, every institute in ICMR is ranked. In the last financial year, ICMR-NIE was ranked third among when it comes to total PEs. ICMR-NIE was ranked fourth when it comes to PE per crore. And ICMR-NIE was ranked top when it came to PE per scientist. So these are not just numbers that I am throwing basically. They reflect the commitment and dedication of the entire NIE team, and again want to congratulate all of you for this achievement. Since last 3 years, ICMR and Department of Health Research has been conducting Health Research Excellence Summit. And in the last summit, one paper that was published from this institute on estimating the burden of human rabies deaths in India, which was published in Lancet Lancet Infectious Disease, was awarded as a best paper. And I again want to congratulate all the investigators, all the co-authors of this paper. So about 25% of our total PE is contributed by our contributions towards program contributions. And in the interest of time, I'll talk about 3 or 4 important contributions in that area. The first and most important, I think, was the project that we have been implementing in the state of Tamil Nadu along with the state TB cell, a differentiated TB care model to reduce TB mortality, early TB deaths in the state. And after implementing this model for about 3 years, we documented a sustained reduction in early TB deaths in almost every district in Tamil Nadu. And that, I think, is a very big achievement, and the learnings from this project were very useful when the national guidelines were framed. The second contribution which I want to mention is about the recent paper which is published in fact today. Is a large case control study that was conducted by NIE to see the association between thrombotic events and COVID-19 vaccination. And following the second wave of COVID, there have been several media reports about sudden deaths or thrombotic events occurring in young adults. And therefore, ICMR conducted 2 studies at that time. The first was already published, which was on sudden death. And this study, which looked into the risk factors of thrombotic events, both arterial and venous, this study found that COVID-19 vaccination was not associated with these events, but traditional risk factors as well as history of COVID hospitalization were the primary drivers of thrombotic events. And this study basically provided evidence about vaccine safety and also helped address public concerns about safety of COVID-19 vaccination. Another study which I want to talk about is a GACD funded project that we have been leading along with Sri Chitra Tirunal Institute. And this study basically showed that community-based interventions for hypertension and diabetes, although have been shown to be effective in control setting, did not demonstrate effectiveness under routine programmatic setting. And this, although negative finding, I think is very important because several state governments are investing heavily on community-based interventions. Then we also completed 2 vaccine trials last year, which again has a lot of programmatic implication. First was a JE vaccine interchangeability study. And this study basically documented that the mixed regime of JE vaccine is non-inferior to a single type of vaccine regime. And second study that we did was the immunogenicity of abridged rabies vaccination schedule. Both these studies are under review basically. Besides research, NIE also has been conducting public health training. And our field epidemiology training program, both a 2-year MPH as well as 1-year intermediate course, as well as the MSc Biostatistics course are running very well. And following this function, we are going to have a detailed discussion with Dr. Yvan about this course and how to scale this course further. But I want to mention one thing about the training programs that our training initiative that we have taken in the last year or maybe 2 years back, and that is the sorted course, the Structured Operational Research and Training Initiative. And this, the work done by the trainees in this course really generated very important evidence to address programmatic challenges, besides meeting 90-90-90 target. And I really want to acknowledge and appreciate the efforts of the entire sorted team for the wonderful work they have done. I also understand that through the Gates Foundation fund that we have received, we will be expanding these courses for other programs. Till now it was primarily for the TB elimination program, NTEP, but we will be expanding to other programs in the coming days. These were some of the institutional achievements, but I will now talk about some of the personal achievements. And in the last assessment cycle, 5 scientists appeared for the assessment, and all the 5 scientists, Dr. Yvan, Dr. Jerome, Kritika, Ranjit, and Dilip, they were promoted to the higher cadre. Congratulations to all of them. Dr. Yvan and Dr. Jerome were awarded a meritorious scientist status. Again, congratulate for that. And although this, what I'm going to talk about is an achievement for the current financial year, but I will mention it here. In the recent cycle of assessment, 4 scientists from NIE appeared for their assessment promotion, Dr. Hemant, Archana, Lokesh, and Pratiksha, and all of them were promoted to the higher cadre. And Dr. Hemant, Dr. Archana, and Dr. Pratiksha were awarded a meritorious candidate status. Congratulations. Well, among the technical staff, Mr. Satish got promoted as Senior Technical Officer. Mrs. Girija Lakshmi was promoted as Principal Technical Officer. Mr. Ramu, Damodaran, Srinivasan, Ebenezer, and Palani were promoted as Senior Technicians, and I want to congratulate all of you for this. Well, none of these achievements, whether individual or institutional achievement that I mentioned so far, would not have been possible without our partners, and I want to thank ICMR and especially DG ICMR for all the support that he has provided to this institute. I also want to acknowledge the collaboration with our Ministry of Health and Family Welfare, the state health departments, medical colleges, research institutions, both in India and outside India, for this collaboration. Well, in the last year, we had several challenges when it came to implementing different research projects, and we have been taking different initiatives to address these challenges. And I will talk about a couple of initiatives that we have taken at the institutional level to address these challenges. The first initiative is, I think, the Research Project Review Committee that we have established, consisting of all senior scientists of NIE. And this committee basically is aimed to review both scientific as well as financial progress of ongoing projects. The primary objective is to identify any challenges or any bottlenecks when we are implementing these projects, identify them early so that these challenges can be addressed. The first meeting of this committee happened, I think, 3 or 4 months back, but I would request the member secretary to convene the second meeting at the earliest. We also had several delays in procurement or purchases of whether it is lab reagents or consumables or equipments. And to address this challenge, I think this has been a major bottleneck for any ICMR institute, I would say. And to address this challenge, we have started what is called as fortnightly review of procurement processes. Such first meeting was over about a month back, and in that meeting, about 52 purchases that were going on in the institute, either pending or currently under process, were reviewed. The bottlenecks were identified and the solutions have been addressed for. Second such meeting is scheduled for next week, and we hope that this periodic review will certainly ease out this procurement process, which has been the major bottleneck when it comes to implementation of the research projects. Well, I also want to specifically mention the contribution of ICMR-NIE's communication unit, and want to appreciate their work for meticulously documenting and showcasing the work of NIE scientists. And NIE got a higher ranking when it came to the PEs. The credit for it goes to scientists, but I will also give a lot of credit to this committee for very meticulously documenting all the achievements, whether it's publications or contribution in program or clinical care. So really want to compliment entire committee for their work. Well, I want to conclude by saying two things. First, about the strategic directions. Last week we had a directors meeting at headquarters. This was a 2-day meeting, and believe me, the entire 2 days were spent on discussing the organograms of different ICMR institutes. And these organograms were primarily based on the mandates, the revised mandate that has been given to different ICMR institutes. For NIE, 3 areas have been identified, and we will be working in these 3 areas in coming years. First is infectious disease epidemiology. That will be our core. We will be working in primarily in this area. Because of our earlier work, we have been also asked to work on implementation research, but it should not necessarily be restricting to NCDs. We will be working on implementation research in communicable diseases, in NCDs, as well as other areas. And the third area that has been identified for NIE's work is the School of Public Health. I think NIE is only institute among 28 ICMR institutes where public health training has been identified as a core area. Again, because of the work that we have been conducting since last 25 years. You may be aware that EFC was approved, and as a part of that, we will be getting 8 new positions of a scientist. But what we are also expected to do is give a number of trainees that we will train in maybe next 3 years. So that is the ask from all the scientists. We have to decide as to how many trainees we will be training in the next 3 years through FATP. The last point I want to say is that last year we got a top rank within top 3 or top 4 ranks among ICMR institutes. And in coming year, it is our collective responsibility to maintain that rank, to sustain that rank. So I would like to conclude my talk by once again conveying my best wishes to you for Institution Day. And I wish each one of you for a very scientifically productive year. Thank you very much, and Jai Hind.
Thank you so much, sir, for that address, walking us through everything ICMR-NIE has achieved and giving us a real sense of where we have been and where we are headed. And on that note, a special congratulations to all our nice family members who received promotions this year, well deserved and well earned. Now, this segment is a big one, so let me do this properly. It's my honor to introduce our chief guest for today, Dr. Yvan J.F. Hutin, WHO representative to India. Dr. Hutin took charge as the WHO representative to India in May 2026, and honestly, his resume reads like a greatest hit of global public health. Before this role, he served as Director of the Antimicrobial Resistance Department at WHO headquarters, leading the world's fight against one of the most pressing health threats of our time. He holds an MD in hepatogastroenterology from France and an MSc in clinical tropical medicine from the London School of Hygiene and Tropical Medicine. He then trained with the Epidemic Intelligence Service at the US CDC and completed his PhD at the Swiss Tropical Institute. So yes, this is someone who has been in the field literally. Over more than 3 decades in public health and 20 plus years with WHO across country, regional and headquarters levels, Dr. Hutin has worked across Africa, Europe and Asia, including Burkina Faso, Uganda and Sweden. He also helped establish the State Injection Global Network, led hepatitis B control efforts in China, and served as Director of Communicable Disease at the WHO Eastern Mediterranean Regional Office. Dr. Hutin has co-authored more than 150 publications in peer-reviewed journals, contributing to the global evidence base for infectious disease prevention and control. So today, we are not just hosting a guest, we are hosting genuine institutional memory of global health. But here's the part that makes today extra special for us. Dr. Hutin isn't a stranger to this campus. From 2004 to 2009, he served right here as Resident Advisor for India's Field Epidemiology Training Program, FETP, the very program that has shaped generation of epidemiologists at NIE. He didn't just support the program, he has been a mentor to the mentors. Sir, on behalf of ICMR-NIE, welcome home and welcome back. And now a small token of gratitude because words alone don't quite cut it. I invite Dr. Manoj Murhekar, Director, to facilitate our chief guest, Dr. Yvan JF Hutin.
इंट्रोडक्शन के अப்புறமா ஓபன் பண்ணிட்டேன் லைவ் ஓபன் பண்ண முடியும்
மினிமைஸ் பண்ணிடுறேன்
எங்க இருக்கு ஓகே நானே ஸ்லைட் ஷோ ஆன் பண்ணி விட்டுறேன் இப்படி வருது
ஆனால் என்ன கேட்கணும் சார் அதான்
அங்கே கரெக்டாக வரும்
கரெக்டாக வரும் சிஸ்டம் அவங்க படிக்கிறது பார்த்து படிக்கிறதுக்காக இந்த மாதிரி
All right, this is the part of the program most of us have been looking forward to. I invite Dr. Yvan JF Hutin, WHO representative to India, to come up and share this insight with us. Sir, over to you. We are all ears.
Thank you so much. So I'm not used to be treated here like a VIP because I was really a family member. And I cannot start with the anecdotes because really NIE feels like a family. But maybe one anecdote that comes to mind, and I don't know why. I was privileged to be invited to a number of vegetarian dinner at Dr. Ramakrishnan home in Vadapalani. And one day he said, how come you decided to go outside of your comfort zone? You were well established in WHO headquarters and you come to Chennai, you know, this is very courageous. And I don't know why, but maybe I needed that external realization to maybe understand that by some standard it could sound like a courageous or brave thing. But for me, it always seemed the most natural and best way forward. And I think I've learned in NIE and from the scholars as much as I've maybe left with them. And the brotherhood that I've experienced with all the team is something that is extremely precious to my heart. And I remember how all of us, we would bring our boxes of food prepared by the various spouses and share that on the same table and eat together in the same way. Should I use a 2 microphone or which? I need to hold this? Well, that's a lot of microphone. Okay, so I think I'm expected to entertain you and also share some life experience. And I thought that maybe something that is a bit personalized and maybe some stories that even my colleagues in the NIE have not heard so far could be of interest. I'm trying to understand how this works. So, voila. So I will share some reflections on zoonoses, epidemic and pandemic preparedness, which are organized around some lifelong learning that I had to experience around Mpox and zoonoses. And I think all of you, you've been to some universities or maybe medical school and you've learned all kinds of facts. And one of the facts that you may have learned is that a zoonosis or a zoonotic disease is an infectious disease of human, but that is caused by a pathogen which is transmitted from a non-human animal to a human. And these things sound like facts. You know, you hear that this disease is anthropozoonosis, this other one is an anthropozoonosis, and these seems like to be written in stone. And going forward in this presentation, you will see that maybe these things sometimes evolve. In 1980, I'm sure you're familiar with the fact that a very important milestone happened, and the World Health Organization was actually at the center of it when smallpox was declared eradicated. So smallpox was caused by an orthopox virus that was 100% human, and therefore by vaccinating everyone and getting rid of the human reservoir, we would guarantee that the disease would not come back. Smallpox also had a number of cousin viruses, one of which, of course, is the vaccine that affect the cows, which has the origin of the vaccine itself, which was used, the smallpox vaccine, which is actually the vaccinia virus that was used to eliminate the disease. So when smallpox was eradicated, there was a bit of a concern that maybe these cousins of the smallpox virus could also cause human infection, and with the cessation of the vaccine, could become a source of a problem. Oops, where am I? There's a slide missing, no? Yes. Sorry, the order of the slides has been mixed up. In 1988, I ended up at the London School of Tropical Medicine and Hygiene, and so you can try to find me on the picture on the left side. And at that time, Dr. Paul Fine was running an exercise based on a paper that he had been publishing. And the paper was an exercise of modeling. So modeling is an interesting epidemiological method by which we basically do a what-if exercise, right? We take a number of assumptions, we project them. And the whole... Tell me. Okay. So the exercise was to look at the transmission potential of the monkeypox virus, or in the human population, in the absence of vaccine-induced immunity. So the modeling, which we replicated as a class, and therefore we sort of learn almost as an established fact, is that the human-to-human transmission potential of monkeypox was probably unlikely to be sufficient to cause transmission in human population, that there could be maybe transmission of a zoonosis of this virus that is endemic to the rainforest from the squirrel reservoirs to the humans. Occasional transmission, maybe a few clusters, but the potential would not be sufficient to generate some outbreaks among humans and threaten the benefit that we had from the smallpox eradication. So this is something that we learned at the time, and that become on the basis of mathematical modeling, but that maybe became a bit of a dogma. Now, interestingly, in 1997, when I was Epidemic Intelligence Service Officer, that is the US FETP, because I was speaking French, I was sent to the Democratic Republic of Congo to investigate an outbreak of monkeypox. I'm calling it monkeypox because that was the name at the time. Now we call it mpox for various reasons. And that cluster was a bit concerning because there was a much longer chain of transmission that had been reported so far. So the question was, were we right with that modeling exercise by which we assume that the human-to-human transmission potential of the virus is not sufficient to cause outbreaks, or is this something that we missed? So on this slide, you can see the epidemic curve with the month on the x-axis and the number of reported cases or identified cases on the y-axis. And you can see in red that you have the primary cases that were, for which there was no reported contact in the family, so those were assumed to be primary cases from an exposure in the wild. And in yellow, you can see those cases that reported a contact in the household. So when we looked at this data, we said that it's still unclear whether the transmission potential, human-to-human transmission potential, could sustain transmission outside of an area where there's zoonotic reservoir. But what we observe is that the combination of regular introduction from the zoonotic reservoir and the person-to-person transmission could cause a number of clusters, and that we therefore needed more surveillance to make sure that this would not evolve into something different, that we need to keep an eye on this whole concept. In the team, there was a number of veterinarian who also captured a whole bunch of animal and examined the presence of orthopox virus antibodies in them. And so this is my colleague Joel William in the lab area that we set up in the middle of DRC. So we got some animals that had been captured in the wild by the local population that would capture them to eat them. And they'd been bled, and we tested for antibodies. So the dogma at the time, again, the fact that was in the published literature, is that the animal reservoir of the monkeypox virus was a certain number of squirrels. And much to our surprise, we found that there was one particular animal called the Gambian rat that people in West Africa like to eat. A number of Gambian rats, 16% of them had antibodies for orthopox virus. And there was no, it's not a finding that we expected before. So we just put this in the article and we say this is hypothesis generation. We cannot confirm they were infected because we've not seen the virus, but we should keep an eye on the Gambian rat and see what happened. So a number of years later, I was I was at WHO headquarters in 2003, working on safe injection, as has been mentioned, and my phone rang, and I picked up the phone, and I heard this person with a very American accent say, "Are you the Dr. Hutin who published on the fact that Gambian rats have got orthopox virus antibodies in the Democratic Republic of Congo?" I was like, "What?" where is this coming from? And I said, yes, this is me. And he said, oh, I am the state epidemiologist of Michigan, and we have an outbreak of monkeypox in Michigan. And I was like, what? So it turned out, and this is published, that there'd been actually an outbreak of monkeypox in the United States because some Gambian rats had been imported to the US and then had passed on the virus to prairie dogs, and the prairie dogs had actually infected some humans. So I'm sure that among all these travelers that you are, some of you may have ended up in the US. If you land tomorrow in JFK with a baby jar, they will ask you to put this in the trash because this is a threat to the US security and etc. But there was no law in 2003 that prevented anyone from importing a Gambian rat from the middle of the rainforest to the US. And so that actually, unfortunately, led to an outbreak of monkeypox. So this is another occurrence of the disease that nobody really had expected. But the hypothesis that we had generated from our data in 1997 that maybe Gambian rats could be a reservoir disease turned out to be unfortunately validated by the experience in the US. Now again, very far from anything we would have ever expected, in 2022, following a number of reports of all kind of clusters in Nigeria and in Africa that were a bit larger than before, in 2022, there was emergence of a completely new epidemiological and clinical form of monkeypox. So the classical picture you can see from this picture that dates back from the 90s, a classical case of African child with monkeypox. And in 2022, there was this large-scale transmission, mostly in Europe, but also in Africa, of monkeypox, also reported quite commonly among men who have sex with men. And as you will see on this summary table from the New England Journal of Medicine, we're dealing with another entity altogether. So the classic form is Africa, and the new form is in country where it was not reported before. The affected population had evolved from mostly children and the general population to young men, many of them being men who have sex with men. The epidemiological features went from sporadic cases to basically much larger transmission. The transmission went from animal to human with few human to human to something that was mostly human to human. And also the clinical features, the symptoms, and so on, was basically a new entity altogether. And while the transmission in 2022 has been somehow brought under control, you're probably aware that since last year, since last year, there's been a transmission reported again, and this is the situation as per the cases reported by WHO since the 1st June of 2025 to May 2026. So we're dealing now with 32 countries that have reported a total of 1,142 cases, 3 deaths. The case fatality ratio is not that high, and the disease is now established in places where it was not at all before. And this is something that is a bit of a breaking news, because this is from the recent month and we're not allowed to share because Pakistan has been actually sharing under IHR the information with WHO. There's been a cluster now among neonates and infants, with a cluster of 9 deaths among neonates and infants. So it's as if this pathogen has found now another niche. 297 suspected cases, 29 confirmed cases, and 9 deaths that has been, as I mentioned, reported to the WHO. with an outbreak investigation that identified a number of healthcare-associated infections. And in the context of a current outbreak of HIV and poor awareness of Mpox. So it seems that among people infected with HIV and in the context of this new transmission, we could also see potentially some cases among neonates, but possibly some vertical transmission and some healthcare transmission. So what I meant to say with all of this is that when we build capacity in epidemiology, we build competency that are based on knowledge, that are based on skills, and that are based on attitudes. The knowledge, as we've seen together, the things that we read in textbook that characterize a disease as something that's written in stone, these things tend to evolve. What is more important to understand, practice, and be aware of is this more complex interaction between the host, the environment, and the pathogens. So the host, if we look back at Mpox the way it was many years ago and today, we went from a fully susceptible population, from a population that was at some stage vaccinated against smallpox, to now a population that is more susceptible, and potential cases among HIV infected people for which the case fatality ratio is higher. In terms of the environment, we went from a situation where there was occasional exposure to the wild to a situation where we have very frequent contact among people with multiple sexual partners. So all these assumptions on the basic reproductive rate, they're based on an expected number of interactions among humans and a type of interactions. And those did not anticipate that different types of interaction that would be more frequent of a different nature would lead to a different reproductive rate. And finally, we've seen also evolution of the clades with now potentially some recombinations among these various clades. And it's interesting because we can see, leaving now the example of monkeypox, we can see that the same type of issues can be observed for other pathogens. I don't know if you're familiar with malaria in Malaysia, but same thing when I was in medical school, in the malaria chapter, there was this small paragraph talking about this thing called Plasmodium knowlesi, which was supposed to be a zoonotic malaria that would actually cause some death and that belongs somewhere in Borneo, in remote place of malaria, but that was not so much of an issue. Now, Malaysia engaged in very sustained and important efforts to eliminate malaria. And on this graph, you can see the number of reported cases in the x-axis, and you see the years between 2000 on the left and 2018. The red cases are the indigenous human malaria. The orange cases are the imported malaria. But you can see that in green, more and more, we see reported cases of Plasmodium knowlesi. And when Malaysia had to consider its case for elimination, came the question as to, can we say that they've eliminated malaria? And it's again the same story of evolution of the environment, because what used to be confined to the rainforest, with the degradation of the rainforest because of trying to get more land for culture, there's an increased exposure of human to the forest. And what was labeled as a zoonotic disease that sometimes will be transmitted to human, it's not really clear as to whether or not there could be human-to-human transmission cycle that would be that could be established. So this is all to say that things are moving, and unless we look at them with skepticism of the mind and sound epidemiological methods, then we might lack the capacity to answer the questions that are needed for appropriate public health action. So what is it that I've tried to communicate? Is that the knowledge is not something that is ever written in stone. It's a conclusion that comes from a process of looking for evidence, but that continues to evolve as the epidemiology and the virus evolve. And what we had learned at some stage has become old news, that monkeypox is a zoonosis with occasional human infection in the African rainforest, and that the human-to-human transmission potential is not sufficient to maintain transmission. Now, these knowledges element, as we discussed, they come and go, but some guiding principle remain useful and can be applied and will take us out of complicated situation. Those are solid. The first one is surveillance is essential to make the difference between the normal and the abnormal. It's by knowing the normal that we say this is abnormal. What we also know is that clinical descriptions and descriptive epidemiology in terms of time, place, person can generate hypotheses. And then laboratory testing and analytical epidemiology in the form of cohort studies or case control study can be used to test hypotheses. And last, we know that the relationships between the host, the environment and the pathogen constantly evolve, and that nothing can be taken for granted, and we need to reassess these relations on the basis of the latest information that we have. So it's easy to communicate information accepted as fact, but it's harder to build the skills and to change attitude so that we can remain curious. And I'm very happy to say this and share that with the incoming cohort of the MPH in Chennai, because I know this is a fantastic team and that those scholars that will be enrolled in that program will be fully equipped with these skills and this attitude when they will graduate in 2 years. So I wish them all the best. And I will close with this quote of a man called Amadou Ampateba, who was UNESCO ambassador from West Africa. He said, if you don't know, you will know ultimately, but if you don't know, you will never know. So thank you very much to all of you for listening to me. And most importantly, also thank you to my brother and sisters of NIE Chennai, who will remain my colleagues in the heart forever. Thank you.
Thank you, sir. 30 years of experience compressed into 30 minutes. That's not a talk, that's a master class. We know your calendar probably runs on different time zone from the rest of us. So thank you truly for making the time for NIE today. I'd like to share a message we received especially for today from someone very close to ICMR-NIE's own history. Our founder and former director, Professor M.D. Gupte. Here is the message. I convey my best wishes to the entire ICMR-NIE family. I am pleased to know that the WHO representative India is the chief guest. Yvan has contributed immensely for the development of NIE FEDP, and I am most grateful to his contribution. Professor M.D. Gupte, founder and former director. Okay, next up. The moment our newest batch has probably been quietly nervous about all morning. Let's give it up for the 18th cohort of NIE. the newest addition to our family. You made it in, and today the institution officially claims you. Let's start with our MPH Epidemiology and Health Systems. To introduce them, I invite Dr. M. Santosh Kumar, Course Coordinator for MPH, to the stage.
Good morning. Before introducing this MPH 18th cohort, I'll briefly mention about our program. Our MPH program on epidemiology and health systems. It began as a Master of Applied Epidemiology in 2001, and in 2008 we initiated Master of Public Health, Health Research Development, Health Services Development Research. In 2011 we merged both this program of MPH HSDR and MA. We created MPH in Epidemiology and Health Systems. Our FETP program is affiliated to Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum. And the model we have adopted is learning by doing, where the scholars in these 2 years they will be splitting the time between the classroom sessions here, and they will be doing real field work like outbreak investigation, surveillance, data analysis. They will be evaluating a program and finally ending their course with a dissertation or an epidemiological study. So with this, the current MPH cohort, 18th cohort, we have enrolled 10 scholars. So I think 8 of them are here, and I will invite them for the introduction. First, Dr. Nivedita.
Good morning, everyone. Good morning, sir. I'm Dr. Nivedita, and I began my career in public health about 3-4 years back, and I'm currently working as a research scientist in the Model Rural Health Research Unit, which is in Tirunelveli, south of Tamil Nadu. So I'm very privileged to be a part of this MPH cohort, and thank you everyone.
Dr. Evelyn.
A very good morning to each and everyone, our distinguished guests, directors, sir, there is esteemed faculties, the staffs, and everyone present here in this auditorium. First of all, happy 27th Institution Day. It is a privilege to be present here on my second day here at NIE ICMR, sharing this platform with you all. So my name is Dr. Evelyn, and I am from Mizoram, the northeast part of India. And this year I heard that I happen to be the only outside candidate from Tamil Nadu for this course, which is quite exciting. So I am currently working as a senior demonstrator in the Department of Community Medicine, that at the one and only medical college we have in Mizoram, that is Zoram Medical College. And I have been working there since the inception of the college, of the medical college, that is in 2018. So why I have chosen here at ICMR-NIE is because I have heard very highly about it from my seniors, and I have always been interested in public health. So now when I get this chance, I have chosen this institution because of the first reason which I have mentioned, and secondly because of its continuous excellence in epidemiology. I have been highly looking forward to studying here, and finally I am here, so I'm very much thankful. I want to learn, I believe that I will learn home and contribute for my state in Mizoram. And I also heard that not only because of its academic excellence, but also for the friendly and the approachable faculties and the very good learning environment. So I'm very much excited, looking forward to learn more about public health and which I can contribute for my state in the future. Thank you so much.
Dr. Muthu.
Respected sir, and my colleagues, very good morning sir, and my best institutions sir. Sir, I am Dr. Muthu from Kanjipuram at Department of Public Health, department engineering department, and now I am working as a faculty officer at the National Faculty Control University, Vellore. And this is my pleasure time to be a part and being a student in this institution. Thank you, sir.
Dr. Milestone.
Good morning, everyone. I am Dr. Milestone, Assistant Surgeon. Currently, I am working as a Assistant Program Manager in Erode District Health Office. Actually, I am thank everyone. From today, I am one of the family member in ICR family, ICMR and NIE. Thank you so much.
Dr. Felicitation.
அனைவருக்கும் இனிய காலை வணக்கம். I am Dr. Felicitation, working as a block medical officer in Mailanadare district, College block. Thank you.
Dr. Shobana.
Good morning all. I'm Dr. Shobana. I'm from Tirunelveli. I'm working in DPH for the past 5 years as assistant surgeon. I'm currently a block medical officer in Nanganeri block in Tirunelveli district.
Dr. Balan. Sir, I am Dr. Balan, Senior Assistant Surgeon, working as a Quality Medical Officer in Madurai District Health Office. Today I joined in ICMR family. Thank you.
Our MPH Epidemiology and Health System program, its model is learning by doing. Scholars split time between classroom sessions here and real field work like outbreak investigations and surveillance analysis. So if you spot a sleep-deprived scholar this year, that's a good kind of type. I thank Dr. Santosh for introducing our new scholars, and I heartily welcome our new scholars for the 18th cohort. To introduce MSc Biostatistics 11th cohort, I like to invite Dr. S. Devika, course coordinator for MSc Biostatistics, to the stage.
Before I begin with the students' introduction, I would like to say a few words about the MSc Biostatistics program at ICMR National Institute of Epidemiology. This program was established in the year 2016 as a part of Institute's vision to strengthen national capacity in advanced statistical methods for health research. The program is offered under the ICMR School of Public Health and is affiliated with Periyar University, Tamil Nadu. The program was introduced to meet the growing demand for trained biostatisticians who can contribute to data-driven decision-making in public health and medical research. Over the years, the MSc program has equipped students with a strong foundation in statistical theory, epidemiological methods, and modern data analysis techniques. So this program is supported with the experienced faculty and its vibrant research environment. The program provides a unique blend of classroom teaching, hands-on statistical computing, and practical exposure to real-world data sets. Today, we are especially delighted to welcome the 11th cohort of MSc Biostatistics students to the ICMR-NIE family. At this point, I wish to invite all our students to come forward and briefly introduce yourself by sharing your name, your educational background, and your hometown. Thank you. Ms. Lokesh, please. Sorry, Mr. Lokesh.
Hello, very good morning to everyone. Good morning, sir. I'm Lokesh. I'm from Chennai. I hold a bachelor's degree in biomedical sciences from Ramachandra Medical College, and I also did a diploma in statistics from ISI Chennai, and post which I also did some work in data science and analyst for 3 years. Thank you.
Miss Victoria-NIE.
Good morning everyone. Good morning sir. Myself Victoria-NIE from Thuthukudi. I done my UG in statistics G. Venkataswamy Naidu College affiliated with Manoranmaniyam Sundara University. Thanks for the opportunity to stand here as a MSc biostatistician. Thank you.
Miss Yasin Banu.
Good morning to everyone. I'm Yasin Banu. I'm from Tambram, and I completed my UG in Madras Christian College, and I completed BSc Statistics. It's my pleasure to have an opportunity to study here. Thank you.
Good morning everyone. I'm Muthrutika from Dindukal. I did my bachelor's in statistics in PSG College of Arts and Science in Coimbatore. Thank you.
Good morning everyone. I'm Shruti. I'm from Dharmaburi. I did my bachelor's in statistics from PSG College of Arts and Science. Thank you.
Good morning everyone. I am Nirupama from Chidambaram. I completed Bachelor of Science in Statistics from Bharat Institute of Higher Education and Research. Thank you.
Good morning all. Good morning sir. First of all, thanks for this wonderful opportunity to introduce myself. I am Yoga Lakshmi from Kumbakonam. I did my UG degree in Government Arts College, Kumbakonam. Thank you.
Very good morning all. I am Malak Karapasamy from Srivilliputturu, Virudunar district. I did my undergrads in statistics from PSG College of Arts and Science. And then have a wonderful day. Wish you all. Thank you.
Good morning all. Myself Rakappan. I am coming from Vadapalani. I completed my BSc Statistics in Government Arts and Science College, Nandanam. Thank you everyone.
Very good morning to everyone. Good morning, sir. I completed my UG in Statistics in SRM University, and I am Rohit. Thank you.
Good morning everyone, and good morning everyone on the dais. I am Ritifa from Bangalore. I pursued my BSc Data Science in from Mount Carmel College. I am grateful and honored to pursue my MSc Biostatistics here. Thank you.
Good morning everyone. I am Pumika. I am from Chennai. I completed my BSc Statistics in SDNB Vaishnav College, Krompet. Thank you.
Thank you, Dr. Devika, and to both our new cohorts, welcome to NIE. As all good things must, this celebration is coming to a close, but not before we say a proper thank you. I invite Dr. A. Ilangovan to deliver the oath of thanks.
So good morning again. It is my privilege to deliver the vote of thanks on account of this important milestone event. First of all, I would like to thank Dr. Yvan Hutin, WHO representative to India. As Director told earlier, he was with us and he was very instrumental in conducting the MAE course very smoothly. Now it is renamed as MPH. Thank you very much, sir, for seeing me again and also coming and gracing the occasion. As you are all aware, this institute is formed by merging two institutes. The one was headed by Dr. S. Radhakrishna and another was Dr. M.D. Gupte. I express my sincere thanks to both of them for bringing up this prestigious institute. And also my gratitude goes to our former directors, Dr. Kumarasamy, Dr. Nagaraj and Dr. Sanjay Magandale, for their excellent foundation laid in making NIE as one of the best institutions not only among ICMR but also in the country. Further, I take this opportunity to express my gratitude to Professor V.I. Mathan and Professor K. Ramachandran for their support and guidance extended in the past in all spheres of our research activities of ICMR-NIE. I also wish to thank our SAC and Ethics Committee members for fine-tuning our research proposals to ensure that they are scientifically and ethically sound. I would also like to thank our current director, Dr. Manoj, who has been constantly guiding us at each and every stage of our research activities. Thank you, Dr. Manoj. Last but not the least, I express my sincere gratitude to the organizing committee members and all the scientific, technical, administrative and supportive staff, including canteen and housekeeping, and also my seniors. I could be able to see Dr. Ramakrishnan and also some other, my ICMR seniors also there. I welcome and also I thank for all of you for coming and gracing this occasion. Thank you all once again. Thank you very much.
Thank you, sir, for that. And truly thank you to everyone who made today happen behind the scene, the organizing team, the support staff, and everyone who set up this beautiful auditorium. And now, let's close the formal proceedings the way we always do, with the national anthem. May I request everyone to please stand for the national anthem? Thank you, everyone. That officially brings us to the end of the 27th Institutional Day program. Thank you all for being such a wonderful audience. You made this easy. On behalf of ICMR-NIE, once again, happy 27th Institutional Day. Thank you. A quick announcement. Lunch will be served from 1 p.m. onwards at the canteen and vehicle parking area, ground floor. Thank you.
which is now packed with some people.